Okay, so today we're going to talk about how blood pressure can help you live your dream life, help you live as well as you possibly can for as long as you possibly can. Blood pressure might sound boring on the outside, but it has such a huge impact on our cardiovascular health.
Absolutely, yeah. So, I mean, you're totally right. Blood pressure is not the coolest thing to talk about, but if we're honest and we're really looking at, I want to live my dream life, which whatever that it means to you means living for as long as possible, for as well as you possibly can. Um, you absolutely have to take blood pressure seriously because if you don't, you're going to be at huge risk for heart attacks, strokes, dementia, you know, kidney disease that puts you on dialysis. And I don't know what everybody's dream life looks like, but I know that it probably doesn't include having those things. And you are leaving yourself at higher risk for those things if you don't take control of your blood pressure and do it as soon as possible.
Yeah, I mean the cool thing about that too is it's also it's a thing we do have power to change. There are a
Mhm.
lot of things that are really hard to change,
Yeah.
but this is easy to screen. It's not necessarily easy to treat, but we have a lot of treatments for it.
Mhm.
And like I know you say often, Scotty, like there's really no reason we shouldn't be able to get everybody's blood pressure like to that target goal.
100%. Yeah, it's one of the most important things we can do. And as you said, there's some things that, I don't know what causes pancreatic cancer, but I know what contributes to things like heart attacks, strokes, all these things. That's blood pressure. That's to say, there's things that we know we have power over. We know what to do. We know how to lower our risk as much as possible. And we're just putting ourselves for, not only, dying sooner than we want to, but, living, but in a state that is not how any of us would want to live our life.
Yeah. Can you like put some numbers to that? Is there data that can exemplify how big an issue?
Yeah, 100%. So two of the things that jump out to me is that in 2020, there were 670,000 deaths in the United States that hypertension was listed or high blood pressure was listed as being the primary cause or a contributing cause. That's
Wow.
670,000 people that, you know, high blood pressure contributed to their death in 1 year. That's crazy. And
Mhm.
then I get people all the time to me when I talk about this, like, well, hey, I'm not afraid of dying. If I die, I die. I'm like, well, okay, well,
Time.
I don't
Yeah.
want you to die, but I respect that, but what if you have a stroke and you live? Or what if you go up on dialysis and you're living with that? Like, that's really bad too. And so to speak to that is that high blood pressure is the number one cause of disability adjusted life years for women, and it trails only smoking for men. So high blood pressure is one of the biggest things we can control if we want to reduce our chance of not just dying sooner, but prevent us from being disabled.
Yeah. And on the flip side of that, help us like live the way we want to live by controlling it. Yeah.
Exactly, exactly. I mean, going to the doctor and hearing them talk about blood pressure is no one is like super jazzed about that. But when you think about it in this context, it's one of the most important things we can do.
What are the treatment goals? I know this is an area of contention,
Yeah. Well,
many.
I would say it used to be an area of contention. Now it's becoming more clear, It used to be back in the, probably 60, 70 years ago, it's like, oh, your age plus 110, which is very wrong. And it's very sad that so many people had that told to them, now that we've had, newer data. Then it used to be, well, less than 140, that seems pretty good. But now the data is very, very clear, excluding people who have diabetes. So if you have diabetes, it's a little more complicated discussion. But for those who do not have diabetes, it is very clear. Your average blood pressure should be 120 or less, not 127, not 129, not 124, 120 or less. That is the number we need to be targeting.
How do we know that and why? Like, where did that data come from?
Yeah, so the big trial in this is called the Sprint trial. They took about 10,000 people and they randomized them, and it was a very pragmatic trial. I think they did a good job, and it was basically half of you or half of these people, so 5,000 people. We don't care how you get your blood pressure less than 140, but we want you less than 140. So that could be lifestyle, weight loss, multiple different medications, but we don't care which ones. We don't care what it is. Just get less than
Let's
140.
do it. Yeah.
And so they did that. And the other half of the people that said, we're going to be more aggressive than that. We are going to take, we're going to take your blood pressure down to shooting for an average of 120. And in these people who, they were, sort of middle-aged people that had high blood pressure, but not diabetes, um, the results were pretty profound. In a little less than 5 years, as I'll pull up here to show you graphically what they did. Pull it up here. There we go. As you can see here on my screen, that top graphic here is the separation of the two lines. And this is the red line or orange line is the line of, is the graph of people who had the more intensive blood pressure shooting for 120 or less. Whereas the blue line is 140 or less. And in this trial, they showed that they reduced relative risk reduction of 25% for the composite of cardiovascular death, heart attacks, stroke, heart failure. There was 25% less of those events in people who targeted a blood pressure of 120. So if you go down into this table or graph B here in this figure, it shows that then they just looked at what about death from any cause? Did you die? Yes or no over this 5-year period? And they showed that there was a relative risk reduction of 27% for all-cause mortality in the people who had targeted a lower blood pressure. So that's to say, if you're someone who does not have diabetes and you have high blood pressure, if you are just shooting for less than 140, which heck, a lot of people, we'd love to get them down to 140. They're way higher than that. But if you just are shooting for less than 140 instead of less than 120 or instead of 120 on average, you're putting yourselves at significant increased risk of heart attacks, strokes, death from any cause, which obviously no one wants to have happen to them or their loved ones.
Right. And that's a really good point. It's not like the two groups were comparing like blood pressure under 120 or like not controlled blood pressure, like 160s, like that's like even what we considered, like what people have considered in the past, like, oh yeah, it's pretty good.
Yeah.
It's like, no, that's actually like, we can get it even 25% better than that.
Yeah. I see people all the time and I'm telling them this trial when I'm talking to them about their blood pressure and I'm like, your blood pressure is 158. You're not even to the less than 140.
Yeah.
And so you're way at higher risk. So that is, one of the most important things we can do if we want to give our best chance of avoiding all those really scary things that obviously can cut our life short, but also just severely debilitate us.
Yeah. What about like beyond cardiovascular disease? Any other benefits?
Yeah. I think they did a sort of a subsequent analysis on this trial, the same sprint trial, and pretty profound finding was that in the group that targeted a blood pressure on average of 120, they had a 19% lower rate of the development of mild cognitive impairment. So mild cognitive impairment is sort of like the beginning signs of progression towards something like, dementia. And there was in just, a little less than 5 years, there was a 19% relative risk reduction in the development of mild cognitive impairment by targeting a blood pressure of 120 compared to those who are allowed to have their blood pressure just be less than 140. So if you want to lower your risk of dementia, which I don't know who wouldn't want to do that, you absolutely have to get your blood pressure under control.
It's so interesting too that this, I think when we think about like risk factors for all of these things, like blood pressure isn't one that discriminates against people who are like generally otherwise healthy. Like there are plenty of people who are active and generally healthy who like still have high blood pressure. But so is there any guidance for like who should be checking this, who's at high risk, or is this just like everybody?
Literally every adult should be checking their blood pressure, not every day, but like, have your blood pressure checked a couple different times a year or for a couple weeks, 2 weeks in a row. Check your blood pressure at home. It's so important to check because as you're right, certainly the people who are have other health problems are more likely to have high blood pressure, but I see plenty of people who are otherwise fit. They're very active. You'd never know that they'd have high blood pressure, and for whatever reason they happen to have high blood pressure. Are there some lifestyle things that maybe even with those kind of those people we could address to try to make that better? Yes, but there's also people that even if they do everything for whatever reason, they just have high blood pressure, and that's unfortunate. It'd probably be even higher if they weren't doing such a great job with everything else. But, we got to get it under control, and thankfully through the combination of lifestyle and or medications, everyone can get their blood pressure under control for the most part.
Totally. Okay, so let's move into like what can we do about this? You've alluded to lifestyle and medicines and stuff like that, but like practically, what can patients do to take care of this?
Yeah, I think the most important thing is get it checked and also know how it should be checked. There's some data that shows that while office blood pressure measurements are very important and they do predict cardiovascular disease, what's more accurate in the prediction of cardiovascular disease is when you're checking your blood pressure at home, because it's easier to follow the best protocols for how to check your blood pressure when you're not in a doctor's office. So how we should check blood pressure is one thing that was really defined by this sprint trial that I've already mentioned. And basically, there's a few things that everyone should know. First of all, you should be seated, not talking for 5 minutes before you have your blood pressure checked. That never happens in a doctor's office.
Yeah.
That's how it should be done. Your arm should be supported at about the level of your heart. And it should be, you shouldn't be holding up, but it should be resting at the level of your heart, not up here, not down below, but at about the level of your heart. Your feet should be flat on the ground. You should have actually gone to the restroom, use the bathroom prior to going to taking your blood pressure, because if you have a full bladder, that can raise it. Ideally, we would like you to measure your blood pressure on the skin directly. Don't use a wrist cuff; those are not helpful. Use an arm cuff, and it should be the right size. If you have too big of a blood pressure cuff, that's going to cause the blood pressure to be falsely low. If you have too small of a blood pressure cuff, that's going to cause it to be falsely high. I think a good sort of recommendation. There's sizing on all the blood pressure cuffs to give you sort of an accurate estimate, but in general, tell people that about 80% of your arm should be covered by 2 layers of the cuff. So there's the cuff kind of opens and then closes like this. About 80% of your arm should have 2 layers of the blood pressure cuff being covered. And if that is the case, then it's probably the right size for you. So that, I think, is the most important thing. Get it checked at the doctor's office, but also check it at home. And if it's not an average of 120 or less, you're putting yourself at higher risk for those things that are, derailing your chances of having the best life possible.
Do you have any recommendations for like where to find a good cuff? How to find one that's like, some of them are wonky and
For sure.
it's accurate?
Yeah. So there's a website I recommend to people called validatebp.org, like BP, like blood pressure, validatebp.org. It's an independent organization that tests blood pressure cuffs, and only the ones that pass their testing as being like the most accurate will they put up for sale. So if you are like, man, I don't know, is this blood pressure cuff at the drugstore, is it good? I don't know. But this website, I think, is the best place to get an accurate blood pressure cuff. I have no financial affiliation with them. I do not, get paid if you go
Yeah.
blood pressure or not, but that would be what I would recommend.
Okay, so what about like getting into the lifestyle stuff a little bit more? Any specific like eating, exercise, things that we know help blood pressure?
Yeah, I think there's a lot of things. Obviously, blood pressure is pretty sensitive to weight. So not everybody who is overweight has high blood pressure, and not everybody that's thin doesn't have high blood pressure. But if you have some extra pounds to lose, blood pressure can be pretty sensitive to that. Physical fitness, there's cardiovascular and strength training have both been shown to lower blood pressure. So lift some weights, go on a run or whatever form of cardio you like consistently. Those things can lower blood pressure. Other things like, do you have sleep apnea? Huge risk factor.
Huge.
Huge, 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 huge. There's some other blood tests that I like to check on people to make sure they don't have abnormal hormone production that's causing high blood pressure. Alcohol. Some people their blood pressure is very sensitive to alcohol. They don't like me telling them that, but sometimes it's the truth. Like sometimes if you cut out your alcohol, your blood pressure will totally normalize. So, and everybody's different, but that's another thing. So those are off the top of my head, some of the bigger things that I think of when I'm trying to help someone do some lifestyle things to lower their blood pressure.
What about like caffeine? Um, we don't have great data, but it kind
I
of
think
makes sense.
everyone's different, like there's plenty
Mhm.
of people that can tolerate it, and then I'm sure there's people as well that it can increase their risk for high blood pressure as well. I think if you're someone who drinks a ton of caffeine and, has high blood pressure, yeah, let's try cutting that down and see if it works. But I don't tell people that they have to go on complete abstinence from
Yeah,
caffeine.
that would not go well.
Yeah, right. I think I'd lose
What
it.
about salt, dietary salt?
Yes, great point, actually. Um, so there are plenty of people that can eat tons of salt and have no issues, but there are also plenty of people who are very salt sensitive when it comes to their blood pressure. In fact, I was just watching a video recently by Mayo Clinic that shows as we age, we get more and more sensitive to salt. So the older
Hmm.
you are, the more likely salt intake is to raise your blood pressure. So
Hmm.
And then especially if you have things like kidney dysfunction or heart failure, like your system is not geared up to handle salt regardless of your age. So
Mhm.
yeah, trying to cut back on dietary salt if you have a high blood pressure issue. And the number I say is, try to shoot for at least less than 2,300 milligrams. Sometimes
Mhm.
we need to get us down to 1,500 milligrams. But even so, if you just reduce your sodium intake, which is salt, so on the back of the label, sodium intake is what you're looking for. Even just reducing it by 1,000 milligrams. If you're eating 5,000 milligrams a day, I'd love for you to get down to 2,300. But even just going down to 4,000,
Yeah.
we can see benefits there. Another thing that's actually really cool is you can do potassium salt substitutes that take out the
Mhm.
sodium chloride and more potassium chloride. That's actually been shown in a study to substituting potassium chloride salts with sodium chloride has been shown to actually reduce cardiovascular outcomes because it lowered blood pressure. So
Blood pressure.
caveat,
Interesting.
if you have kidney dysfunction, be very careful with checking
Another
or
ball game.
potassium. Yeah, for sure. But that's another thing. And then the last thing that I'll mention now that we're on that is there's been a higher association with potassium containing foods and lowering blood pressure. So,
Hmm.
that doesn't mean you have to go eat bananas because there's plenty of other foods that are high in potassium, but things like sweet potato, beans, certain types of beans, certain types of vegetables are very high in potassium, and that has been shown to lower some blood pressure. Again, if you have kidney dysfunction,
Yep.
please consult with your doctor and be careful. But those are all the things that I think we can do, and we haven't even gotten to medications. So all this is saying like there are so many ways we can hit blood pressure
Yeah.
as long as you can tolerate having the blood pressure at 120 and you don't get lightheaded or dizzy or whatever, like we can get it there, no doubt.
Totally. And I'll just add too, I think like so much of this is like, especially, well, two thoughts. The sodium, first of all, we're not just talking table salt, it's
Yes.
like the processed foods are like so full of sodium. Like even things you would never think, something sweet. You like look at the back of it and it's like, why is there 1,000 milligrams of sodium in this? So it's just everywhere. So just looking, I think, can be a huge helpful first step, looking at labels, trying to eat less processed foods, more whole foods.
Yeah.
And then the sleep apnea thing is, I feel like sleep apnea is, I'm learning more and more like the underlying like cause of everything.
Yeah.
But if you snore, if you wake up in the morning feeling like you didn't get a good night's sleep, those are signs that perhaps you have sleep apnea. So if that rings a bell with you too, and especially if you have high blood pressure, bring it up. We should be asking you about it anyways in our clinic visits about high blood pressure.
Yeah, for sure.
So
No, yeah, I couldn't agree more on both of those things. 83% of the sodium that Americans consume is already put into food. So if you are not adding, salt to your food, you're like most Americans, but you're still probably getting too much because, like I said,
yeah, yeah, totally.
isn't already in the food. And then yeah, sleep apnea, incredibly common. Go get it screened. Obviously, we would love for you to come see us and we can help you do that. I just, recently have been ordering a bunch of home sleep studies. Super easy. Patient gets a screening study at home, comes to their house, don't have to go to a sleep lab to give us a good sense of do you have this or not. So it can be very easy to screen for sleep apnea. You just have to tell your doctor about it.
Totally. All right. Any takeaway points?
Yeah,
Last words?
Yeah, I would just say, the three things that come to mind. Number one, this is really important. Our whole purpose of this is we want to help you have the health you need to live your dream life. And that's how do you live as well as you possibly can, not only at age 85, but at each moment in time,
Mhm.
chapter of your life. We want you to be able to do the things that you want to be able to do for as long as possible and live for as long as possible. There's no doubt in my mind, blood pressure is very important if we take that seriously. So if you're serious about wanting to live your best life, get your blood pressure under control. What that means is check your blood pressure at home. I talked about how we can get it the right cuff, validatebp.org. Check it. The average should be less than 120 or 120 or less. If it is not, your blood pressure is higher than I want it to be. And then the other thing I would say is, there's lifestyle and there are medications. But the most important thing is getting it down there. And so if you are apprehensive about doing one of those, medication or lifestyle, just know this is so important. We got to get it down however we can get it down.
Awesome. So yeah, keep an eye out on our social media feeds and our YouTube channel to see what other topics we come out with next. And we'll see you next time.